When we talk about disparities that exist in our healthcare system, the subject of asthma seems so up in the air. But have you ever asked,
why do black children have more problem with asthma than white children? This is what we call a disparity. And a health disparity is when one group of people have a different experience than another.
Many would be surprised to learn that asthma can be considered a social justice issue.
Social injustice is when one group of people can't get the same treatment as another group of people. Different treatment based on how they look, their race, their poverty status, their insurance status. And there have been studies that have shown how African Americans are treated differently and less optimally than white Americans. And I think that's the saddest part in healthcare. That is the social injustice, how we are treated very often differently than other people.
Former Secretary of State and First Lady Hillary Clinton echoes this statement.
We need to do something about the racial inequities in our healthcare system. Right now, black kids are 500% more likely to die from asthma than white kids. 500%. Right now, a black baby in South Carolina is twice as likely to die before her first birthday as a white baby.
And the stunning thing about that is that many of those conditions that were identified as disparities in 1985, in 2022, are the same, some are even greater.
In the article, Being Black Doesn't Cause Asthma, the Neighborhood Does, two Princeton scholars break down that it's not race, but living conditions that account for the asthma disparities.
When we study these issues, we find that there's a lot of components related to the socioeconomic status of their family, healthcare access, transportation to get to the doctor, using emergency rooms as a substitute for a healthcare provider, and poverty. Some of these medicines are not cheap, and we have more poverty in our race.
The pediatrician to Black Louisville for several decades, the good doctor writes up a prescription to parents on things to look out for.
And with asthma, to avoid thinking that children grow out of it, because they don't. That asthma is episodic, but it's chronic. So we say when you start having cough, particularly night cough, that's how it usually begins. If you have night cough, bring them to the doctor. Follow the instructions of the physician meticulously, because asthma is a disease. Some medicines have to be given every day. Some medicines have to be given only when you have an acute episode. So resources include reading about the disease your child has, but the primary resource is going to come from your relationship with your physician.
And the importance of good pediatric care.
Find a provider. I would love to say find a provider that looks like you, thinks like you, and I think people should interview doctors. We open our office to new mothers, actually any new patient, to come in and see how we feel about each other and make sure it is a good fit, because that's somebody you're going to be with. We're now seeing the third generation of some families. So that relationship is very important.